Hi, everyone. Again, my name is Dr. Corey Bills. I'm going to be talking about climate change and emergency care, establishing the research. And I'm really excited to be here to be with you and to be able to talk about this. The aims of this talk are really to provide a sense of the past, so where we have been in terms of the state of research on the intersection of climate change, emergency care, and Africa, to give you a sense of the present state, to show current examples of research and where current gaps exist, and to allow some time to kind of propose a sense of what the future might look like and give some examples of possible solutions to the current research gaps. So let's begin with the past. So this is a picture from an article titled "The Melting Arctic is a Real-Time Horror Story. Why Doesn't Anyone Care?" and why recent epic wildfires and other extreme weather events have a root cause. The problem with this picture and why it's hard for a lot of us to think about or care about climate change is that we're often presented with pictures of this, which for most of us seems entirely remote. But the problem is that icebergs such as this or the warming Arctic is really an early warning system. And as the Arctic heats up, it raises sea levels in Miami and Bangladesh and along the coast of West Africa, and it increases the odds of extreme weather events wherever one might be in the world. So let's take a quick step back and talk about kind of where research has been in emergency care and climate change in the past. From an emergency medicine or global emergency medicine perspective, throughout the last 10 years, we've seen a steady increase in the amount of research around global emergency care. Every year, the Global Emergency Literature Review tracks articles published in peer-reviewed journals around global emergency care, disaster and humanitarian response, showed in the blue here, and emergency medicine development. And what you see is that from 2011 all the way to 2015, we see essentially a 3.5-fold increase in academic productivity. Again, this only really represents a small fraction of the work that's being done, as most work goes unpublished, but it still gives you a sense of how well we've been doing in terms of increasing literature within the field. At the same time, we've been increasing the amount of clinical research, that research that happens within a clinical environment and has a clear relationship with care provided to individuals. And again, we see almost a doubling of research from 2013 to 2015, so just over a 2-year time period, or 3-year time period, I should say. At the same time, we've seen a steady or almost logarithmic increase in the number of papers published around climate change. This is a bibliometric study of a large publication set dealing with research on climate change over 25 years, from 1980 to 2014. In total, they found over 220,000 papers that were relevant to the broad topic of climate change. And again, a strong increase in a near logarithmic scale with a doubling of output about every 5 to 6 years. The kinds of research that's being done is broad around climate change, but as it relates to health, adaptation, impacts, and vulnerability, each represented by a dashed line on this figure, gives a sense of the increase in climate change and health-related research. More specifically, that related to medicine is represented by the green or kind of olive colored line on this table. And what you find again is that there's a general increase, but as compared to the rest of the work being done around climate change, the work around climate change in medicine or climate change in health is definitely a fraction of the overall percent of papers relative to the work being done in 1980 to 2015. That being said, even though there seems to be less research, again, it's still increasing, especially as you look from, say, 2000 to 2014. And even with the small amount of research, we find that um, that there are some clear risk factors for climate change. So this article, entitled Climate Change in Human Health, Present and Future Risks, published in 2006, establishes kind of main known and possible health hazards of climate variability and climate change. The nine listed here, or nine hazards listed here, that have a clear relationship with adverse and both beneficial effects in some cases, include temperature extremes, floods, allergen airborne allergens, food poisoning, waterborne infections, vector-borne infections, regional crop yields, fisheries, and sea level rise. And so if we look at some of these, or a couple of these in more detail, we can look at what each of these hazards has in terms of effect on health. So from an adverse effect standpoint, let's just take two examples. So floods, for example, have been known to increase injuries, including deaths from both initial trauma and from the secondary sequelae of infectious disease, from a lack of clean water and destruction of shelter. Similarly, regional crop yields, which we don't tend to think about in our daily practice in emergency medicine, will lead to decreased food availability, increasing hunger, and likely the amount of malnutrition that we see in our emergency departments. At the same time, there might be some areas where we see beneficial effects from the hazards of climate change. And that's not to say that the adverse effects are no less important, but just to give you a case where one person living in one area might see a very different pattern in terms of the effects of climate change. So let's just take the example of temperature. So as temperatures increase throughout the world, secondary to climate change, the increasing temperatures, especially in more temperate areas, may lead to less cold-related injuries, as an example. So that's kind of where we've been in the past. And so I think it's a little bit important to kind of now talk about the research that's being done on the overlap between climate change and emergency care. So part of the reason why it's complicated or hard to kind of establish this kind of research within our field is that the reality of climate change is that it's incredibly complex and interdependent. So this is just a graphical or pictorial representation of all of the different things that make up or lead to the science of climate change. In the same way that that first picture of a melting Arctic is hard for us to kind of imagine how that might play out, say in South Africa or West Africa. In the same way, it's hard to kind of understand when we're working in the emergency department how to think about the effects of a patient's individual presentation might be the result of global warming. The reality, though, is the impact of climate change on health is likely to remain complex but significant, and will include effects on cancers, cardiovascular and respiratory disease, food, water, and vector-borne diseases, heat-related illnesses, mental and social well-being, nutrition, trauma, and vulnerable demographic sectors. Like I said before, based on the current data, a true understanding of these complexities from the standpoint of health, or in this table represented by social impacts, is generally lacking. So we've seen an incredible increase on the literature on global emergency care as well as on climate change, as I presented before, but there's been little overlap on the two combined. This table represents a matrix showing valuation uncertainties for climate change impacts, including economic, social, and in this case, including medical or health, and climate change uncertainties of increasing complexity, showing where past studies relevant to Africa have been concentrated. So what you see, at least as it relates to the social impacts, those related directly to people at risk or mortality, we see that few, if any, changes have addressed either mean climate changes, climate variability, or system changes and singularities. And by singularities in this chart, they mean things like individual events like cyclones or wildfires. This is another kind of pictorial representation in this paper by Houndschild in 2019, published in the Journal of Infometrics. This provides a visual representation of key words from a review of climate-related science articles. And what we find lacking, if you look closely at each of these key terms, is that terms such as Africa and emergency care really don't make it into this graphic, representing a general dearth of keyword use and literature on the subject. Put another way, this paper by Peter Bias called Climate Change and Population Health in Africa poses the question of where are the scientists? And, he provides a much more in-depth analysis of the lack of research on the topic coming out of the continent of Africa. But just as an initial kind of starting point, he did a search through a well-known kind of online search engine through PubMed and used the 3 search terms health, climate change, and Africa, and found that only 31 articles met those specific criteria for each of those 3 search terms. Not unsurprisingly, when we replaced the search term health with emergency care, or even with the word emergency medicine, we only get 12 articles. And the reality is that not all 12 of those articles are even pertinent to the subject at hand. And again, while this isn't a kind of scientific approach, it does provide a quick snapshot of where we're lacking in research. Even if we're to take a step back and we go back to that one study that looked at the overall number of papers being presented on climate change, again, that's 220,000 papers as presented by Houndschild, we find that climate change research in Africa is really only represented by South Africa in this paper, which produced 2,100 articles over the 25-year time period. That's not to say that there isn't research coming out of Africa. There's lots. It's just that as a proportion of all the other literature coming out of there, there's still not as much, and certainly a gap in terms of the literature that we could see. On the other hand, I want to highlight 4 publications that provide empiric data on the subject and give us a sense, a little bit, of how we might start thinking about other research topics that we might care about. So this first paper by Bryson et al., entitled The Neglected Tropical Diseases in the Context of Climate Change in East Africa, is a systematic scoping review published in the American Journal of Tropical Medicine and Hygiene. And on this first figure, the authors highlight the publication frequency of articles relating to climatic factors and neglected diseases in East Africa over a nearly 50-year period. And what we see highlighted by the darker colors are that the majority of papers are centered in Kenya, Ethiopia, and Tanzania. Again, with publication frequencies close to about 30 in each of those countries, Kenya having the most. At the same time, over that 50-year period, much like the data on global emergency care publications on climate change, we see that a general increase in the publication frequency of articles related to neglected tropical diseases in East Africa. Moreover, the increasing publications tend to correlate, as the author suggests, with increasing policy at the international level. So with the start of, say, the first WHO global report on neglected tropical diseases in 2010, since that time, aside from, say, 2015, we see a near linear increase in the amount of published manuscripts. Lastly, the authors also provide detailed info on neglected tropical diseases, climate variable specific, and social factors. And so what they find is that most common were articles on schistosomiasis, followed by soil-transmitted helminthiasis or human African trypanosomiasis. From a climate variable of interest, the most likely variable reported was on precipitation, or factor, I should say. Reported on was precipitation in 91 articles, and then followed by temperature. Droughts and floods were less studied in this cohort of papers. They also looked at associations between neglected tropical diseases and changing climate, which they found increasing over time. But what they also saw that over time there was a decrease on the reports of indigenous identity and age factors over time. So those social factors that may have also a play on the relationship between climate change and health. And lastly, they found that even though there are a fair number of articles, there are substantial knowledge gaps for several countries and for many neglected tropical diseases. This review tended to bear witness to a report published by USAID, which looked at data on the expansion of schistosomiasis, malaria, cholera, and meningococcal meningitis throughout sub-Saharan Africa as it related to climate change. And as an example provided by this, the pictograph of the small mosquito, what they're saying essentially is that you're going to start seeing increasing rates of malaria secondary to climate change in places like West Africa and East Africa. Our third example of a paper that reports on climate change and health outcomes is one in which authors in Burkina Faso looked at the relationship between seasonal patterns of cardiovascular deaths in adults, which they thought to be influenced by both hot and dry climates. This is a rural setting. It included over 11,000 patients, where they recorded deaths over a 4-year period. They found that there were 1,238 cardiovascular deaths, and it was the fourth most frequent cause of deaths in this cohort. The mean monthly temperature was significantly related to mortality, especially in older aged individuals. And what they found overall was that cardiovascular mortality varied by season, with higher mortality rates in the hot and dry season. So what you can imply is that as climate change increases the variability of seasonality or increases temperatures on a year-by-year basis, the heat wave effects that we've observed in other areas will likely have greater implications for increasing mortality from cardiovascular deaths as climate change worsens and temperatures rise, especially in this area. Our last paper is one that I think is a little bit closer to home, and this paper by Koka and colleagues out of Tanzania, who are all emergency-based providers, uses a descriptive cross-sectional survey of 25 hospitals throughout the country to assess emergency disaster preparedness and response. What they found is that all hospitals, and these are referral hospitals, have inadequate numbers of all cadres of healthcare providers to support effective disaster response. And 92% experienced a disaster in the past 5 years, with the most common 2 of 3 related to climate change, and that included floods and infectious disease outbreaks. The most common was multi-vehicle accidents. But the reality is that in order to kind of mitigate and adapt to the changes related to climate change, our emergency departments are probably ill-prepared in many clinical settings to be able to deal with these changes, as they found in Tanzania. So hopefully these 4 papers, alongside kind of the past studies that I've presented on climate change and global emergency care independently, give you a sense of where the research currently stands. So let's take a minute briefly to really just kind of uh, hypothesize about what the future state of emergency care research in Africa as it relates to global climate change might look like. Again, this is kind of, I think, how we generally think about the effects of climate change. It's this interdependent system that is in some ways hard to make sense of, and harder still to then kind of write about in the scientific literature, especially the scientific literature that we use most often as emergency clinicians. The reality, though, is that the projections and the direction and scope of health consequences related to climate change are going to involve a degree of uncertainty, which will likely make it difficult to communicate scientific facts to our colleagues, to policymakers, and even to the general public where we live. So people have kind of taken these graphics and tried to simplify them in a way that makes it a little bit easier to understand. So this schematic is one way to think about all of those different variables, and it summarizes the main pathways by which climate change affects population health. So what we have at the top are the far left-hand side, starting with anthropogenic greenhouse gas emissions, is that this leads to climate change. Mitigation, which refers to true primary prevention, so reducing greenhouse gas emissions, may or may not lead to worsening or decreasing climate change. And here, by climate change, we're really looking at climatic conditions and variability. So let's say temperature, precipitation, humidity, and wind patterns. So if we can measure those things, say at the local level, state level, district level, or national level, we can then think about how those effects lead to or how those changes lead to environmental effects. These environmental effects, here listed by extreme weather events or effects to ecosystems or sea level rise or environmental degradation, then have direct effects on our health, the kinds of things that we see directly within our emergency departments. Again, adaptation allows us to kind of mitigate the effects, or I should just say adapt to the effects, because mitigation, again, is something a little bit different, but adapt to these environmental effects to lessen the health effects that we might see in our emergency departments. So this gives us a sense of how we might think about climate change as an independent variable, and the outcome or the dependent variable of the health effects later on down the line, and how we might start to measure those things as it relates to research. Again, this is an even simpler schematic where we think about exposure, right? Again, the effects of climate change, how sensitive the system is or the individual is within a study, and then the potential impact, right? The outcome of the exposure as it relates to a sensitive system. At the same time, we can also think about adaptive capacity, with adaptation reflecting the ability of a system to change in a way that makes it better equipped to deal with external influences. So this might be kind of modifying factors within a system or within an individual that then lead to an overall sense of what the vulnerability or the degree to which a system or individual is susceptible to or unable to cope with the adverse effects of climate change, including climate variability and extremes. So again, we're looking at exposure all the way through a system, with thinking about all of the different variables as they relate to a person, and then thinking about what the overall vulnerability or outcome, either as a system as a whole or an individual within a study, might look like. So hopefully that kind of provides a simpler sense of how we might approach a kind of research from an emergency care standpoint in the future. So again, just to go back to this question posed by Peter Bias in his article on climate change and population health in Africa, where are the scientists? My hope is that we can think about the fact that these scientists are here at AFSEM, and that we can utilize these tools and this research as an opportunity to answer the question posed by Peter Bias, and that you all will drive the research agenda for climate change and emergency care specific to the region. So overall, over the last decade, there's been a noticeable increase in published material on global emergency care. This increase is similar as it relates to global climate change as well. And while we can extrapolate some of this data to Africa and specific contexts, these are harder to make relevant to everyday life and represent a paucity of data specific to Africa itself. So fewer articles address global emergency care and climate change specifically. Fewer still focus on the measurements of impacts of change and outcomes specific to emergency care, and even less relate specifically to emergency care in Africa. And even non-emergency health-related research relevant to Africa tends to focus on broad policy and measures of association at the national, subnational level, or without specific data on facilities. Additionally, few studies address ED-specific capacity in Africa as well, and no studies provide data on implementation of African ED-specific tools aimed at mitigating the effects of climate change in the future. So in conclusion, there's a definitive need for more data on EM systems development outcomes, and one first step may be to set a consensus-based agenda for research around emergency care and climate change in Africa. And hopefully we can take a little bit of time within the workshops to talk more about this. So I leave with a question, which is, what research areas should we focus on in the future? And if you guys have questions or comments, I can be reached here. And it was wonderful to be able to talk to you all today about this subject. Thank you again.